I want to thank you all for coming. I welcome you to this presentation I'm going to do on cervical cancer. Um, just, I hope you feel welcome and you like this presentation. I want to remind you that it is hosted by brightbot.com. I want to remind everybody here that you're going to be muted while the presentation is going. But at the end of the presentation, you'll have some time to ask some questions, which I hope you have, because that is the part I enjoy the most. So let's begin. Okay, well, first of all, let me introduce myself. My name is Jaime Meza. I am a physician, born, raised, and I studied in Colombia in South America. I have dedicated my medical life to the emergency room, but also a very good part of my medical life to occupational health and prevention of chronic disease. So I have a special love and a special relationship with all preventive medicine, including, of course, many types of cancer. Today I'm going to talk about cervical cancer, which is like every cancer, a very long subject, but I'm going to just try to do and tell you certain basic things. I really think it's very important for everybody, men and women, to know about it. So let's start. First of all, what is cervical cancer? I mean, we all know that cancer is a very aggressive disease that in a certain way has an impact in the life of everyone. Cervical cancer specifically is a subtype of uterine cancer. That means it belongs to the cancer of the uterus. It affects the first portion of the uterus, which is called the cervix. It is a very special cancer because it is in a certain way related to the skin cancer. In what way it's related? That it develops in the surface, like let's say in the skin, and then it starts to grow in, different from other types of cancer in which, for example, liver cancer, it might start in the deep in the middle of the tissue, the organ. This one starts in the surface, which is, let's say, a very good thing because it helps us in the diagnosis and treatment, but we're going to talk about that later. Well, here you have a sketch where you can actually see, because probably all of us are familiar with certain terms here, but I just want to make sure all of us know what we're talking about. So there we have the uterus and the cervix, which, like I was telling you, is the first part of that organ. And then right there in the circle, it's like little sketch, little drawing on it of how the cervix looks in a normal patient. Why does the cervical cancer appear, and who is at risk of developing? I will have to say that this is one of the most common questions I get asked all the time, but it's one of the most difficult. We don't really know exactly why cancer appears, and this is something that applies to almost any kind of cancer. Simply, we know that cells are supposed to reproduce and divide at a certain rate, and there is something that makes that cells start to reproduce in a too fast, uncontrolled, I would say. Specifically with cervical cancer, there are certain genes that are related, and actually now there are biologists and doctors working, trying to figure out and actually identify which specific genes are related with this cancer and make certain people have more probability of having it, so we can develop an earlier diagnostic test. Who is at risk? Well, of course, being women, the only that have a uterus. Well, this is women's cancer. But even though any women can have cervical cancer, obviously there are certain things that make certain women more prone to have cervical cancer. Of course, the first and most important risk factor is the human papilloma virus, or the HPV. I think a lot has been said about the HPV and the relationship with certain types of cancer, but the most important is with cervical cancer. I'm gonna just give you some little explanation about the human papilloma virus. The HPV is a virus that is spread almost everywhere. We can say that 85% of the population are or have been infected by this virus. But there are more than 150 subtypes of this virus, and most of them are related to some other conditions or to no condition whatsoever. They usually cause what we call papillomas, which are like skin. They affect the skin and they cause like some skin lesions. Very, very common within people, not malignant whatsoever. Now we have identified certain specific subtypes, especially HPV 16 and 18, as responsible for being a risk factor for cervical cancer. Why? Because this virus specifically infects cells from outer layers of the skin or certain mucous membranes. And as I was telling you, this cancer develops in the surface. So if something affects the surface of the skin, it will make it more likely to develop cancer. What are other risk factors? Smoking, it's a very big risk factor, not only for cervical cancer, but to other cancers, but it is very important with this one. Immunosuppression, in many different ways. Immunosuppression is basically when the immune system, the defense mechanism of the body, it's not working properly. So it is easier for certain organisms, either viruses, bacteria, or parasites, to get inside the body and cause certain damage. Obviously, nowadays, with HIV being an epidemic, that is like the biggest risk factor regarding immunosuppression, but can also be caused by use of prolonged use of steroid drugs, certain born conditions like immunodeficiencies, and even certain stress-related immunosuppression. So people who are undergoing lots of stress can be immunosuppressed. Diet, and this is very, very important. And nowadays, reading about cervical cancer and some other types of cancers, we've started to discover that the diet is very important in not only developing but also uh, treating cancer. Low diets, I mean, diets that contain low fruits and vegetables are related with the appearance of cervical cancer. Being overweight, it's another risk factor because being overweight causes in women, I mean, both men and women, but in this specific case, women to have certain hormonal disbalances because many of the hormones are uh, fabricated by the taking the cholesterol as the like primer, and everything the rest of the hormone just builds itself in that core. The core is the cholesterol. So if you have more fat, you have more cholesterol, then you have more hormones, and those hormones can be a risk factor for cervical and breast cancer also, but in this specific case, cervical cancer. And uh, having the first baby before the age of 17 is a risk factor for developing this. And nowadays, it's something that is being seen all around the world now. 16-year-olds and 17-year-olds are getting pregnant. So they are a specific group that has to take care of very specially and have to go to the doctor to get assessed and screened for cervical cancer. Of course, what are the symptoms? That's another question that's very important. Um, Many other cancers are more aggressive in the way they present, like maybe painful or might be very obvious. In the case of cervical cancer, this is not the case. Unfortunately, uh, being asymptomatic, having no symptoms, is what most women are gonna have in the earliest stages of cervical cancer. And since the cervix is located in a place where it's impossible for anybody to see without a appropriate examination, it is very difficult to actually know somebody's having trouble with their cervix. So this is something that should be taken in mind because this is actually the key point of why is this so important, because it is very silent and it is something that might be affecting a lot of women, our mothers, sisters, cousins, grandmothers, and not even, I mean, nobody knows about it. Um, of course, when the disease progresses, it might start to have some other symptoms. For example, abnormal bleeding or some kind of discharge. And this is also some symptoms that are not very specific, because for women, having an abnormal bleeding might be, I wouldn't say normal, but might be a little bit common. Some women have certain bleeding between their menstrual period and some others don't. So that not necessarily means you have cervical cancer, but at least that means that it would be good for you to get checked, especially because it can rule out some other conditions that may be causing you these symptoms. And pain during intercourse. That is another symptom that it's very common with this, with cervical cancer. Then what is the big deal? I mean, there's so many cancers, there's so many conditions. Why is it that cervical cancer is all around the news, all around the magazines, and why is it that I consider very important to talk to you about it? Well, I'm not the kind of person or the kind of doctor that likes to throw numbers to my patients and statistics, but I just chose a few so you can actually see the importance of this. These are up-to-date statistics. In 2017, there will be more than 12,000 new women diagnosed in the U.S. And I think 12,000 is a lot. Uh, if you read these statistics, which are public, you can either get them from the CDC or well, cancer.com. You'll see that there are some other cancers that will be, I mean, be affect more women than the cervical cancer. Then why is it that I chose to talk about this and to spread the message about the cervical cancer? Well, the statistics starting 50 years ago, you would see that in the 1960s and 50s, the rate of cervical cancer was 10 times or more higher than now. And it's actually being decreased year by year. And don't get me wrong, that is a very, very good thing. Actually, that's amazing. But why isn't it zero? It should be. Of those 12,820 women, 4,000, more than 4,000 will die next year from it. And I think that's very important when we realize that those women are, like I said before, our mothers, our wives and girlfriends, fiancés, sisters, cousins, grandmothers. Some cancers we're not able to diagnose early. We're not able to treat them properly, and death is now inevitable. But for cervical cancer, we are in the point where we know enough to either prevent it, diagnose it on time, and treat it appropriately. So that means that number should be zero. And we shouldn't rest until that number is zero. Eventually in the future, the rest of the cancers will be zero. But this is something that should be right now in a zero. No deaths, no new women diagnosed. That is the goal we're supposed to do it. And I'm trying to help that and trying to deliver that message to you right now. That is the big deal. I hope you get the message and you understand. Is there anything we can do about it? Of course. That's the goal of this. Yes, there's something you can do. Stop and modify your risk factors. If you're a woman or the husband, or you are, if you're affected or you're a woman, stop smoking, change your diet, exercise. And if you are a husband or a brother or a son, well, talk to them about this and tell them, hey, mom, hey, honey, you should change your lifestyle. You should quit smoking because I want to be with you for many, many years. And this is so easy. And I want you to be one of those 4,000 women. There are two things that are very important with that. And I chose to deliver that in a different, in a separate page, is that right now the risk and the assessment we do is with the pap smear and the prevention through the HPV vaccine. Yes, the HPV vaccine should be administered to women starting age 1 up to 22 years old, and even more if they are immunocompromised, having HIV or other disease that might affect their immune system. They can have it up to 27 years old. A lot of controversy has arisen with the vaccines and the vaccine movement, and it's not the subject of today, but I'm just telling you, the data shows it is very safe and it is saving lives. So I totally recommend it, and I hope you do it. It's not too late. Why 11 years old? Because the vaccine is more effective if the woman has never had, or man, because this is also available for man, never had a sexual relationship, sexual intercourse. So, and so it is better. I mean, they chose 11 years old like a, starting point. But even if you had, even if you're 16, 17, 20, and you can still do it, and data shows it still prevents. Not as good as if you had it at 11, but it will help you. So please remember, it's very safe. It's very safe. The pap smear. This is the best strategy we have for early diagnosis of cervical cancer, and it's the um, thing that you should do in order to be sure that you don't have it, or your partner doesn't have it, or your relative. Uh, it is also controversial in a certain way, or at least a taboo. Certain women don't like to do it. Certain women say it's painful, very uncomfortable. And what do I have to say about that? Well, it's definitely not a comfortable exam. That is very clear, because cervical cancer is on the genital area. So of course it's gonna be a certain discomfort about it, but it does not necessarily mean it has to be painful. I mean, you have to build a very professional relationship with your doctor or your nurse, and I'm pretty sure they will be able to perform it without any pain whatsoever. Who should do it? Starting age 21 and until 65. If you've never have any abnormality, you can stop at 65. If you had, you should do it until 10 years after the abnormality appeared. So what does it mean? That maybe you were 50 and they found 60, and they found something abnormal. They treated and now you have nothing, but that means you don't have at 65, but you need to extend that period to till you're 70. But if you are between 21 and 65, you should do it at least once a year. Uh, and starting at age 30, the pap smear has to be, or at least is recommended to be uh, done with the HPV screening test, which is done in the same sample. So it is something the doctors and nurses here in the United States are taught how to do, and they will do it for you. But even if they don't ask you, you are supposed to ask, because this is your health and this is available for everyone. This is very important. Well, I think there's a lot to talk about any preventable disease, and cancer and cervical cancer. Uh, I think that's like enough for today. I think I have certain more things to say about it, and treat certain things about what you should what you should do if you are diagnosed, which are the adequate treatment, and certain specific tips I have for patients to lower the risk. But we should cover that in a later presentation. So now is the time that I will give for you to ask questions. Please, I encourage you to do questions, uh, and thank you for your time.
Dr. Mesa, I have a question. Can you hear me?
Yes, go ahead.
Okay. Why is it that children, I mean, young ladies, you said 60 who have had babies before the age of 17 are prone to cervical cancer? Why do you think that is?
Why is it that young women uh, prior to age 17, you said?
Mhm.
Well,
Yes.
yes. When you see the statistics, you see that actually, and this is something that is very important. Your question is very, very good because we have seen that younger women are at a highest risk than older women. Um, I think I think there are several reasons why that might be the case. First, what we have learned about the HPV infection is that it's very related with the immune system, and the immune system of an immature individual, let's say a teenager, it's more likely to develop certain cell division abnormalities. Maybe if this young lady it's not exposed to the HPV virus, she will still be at risk because of the immature immune system. Um, but of course, the greater risk comes when she is exposed to the virus um, later when she starts having intercourse. But yeah, we have discovered that the immune system, and it's actually related with certain immune diseases like lupus or certain autoimmune diseases. So maybe that's the relationship that it has. So yeah, it is very important actually to start screening young ladies, not before the age of 17, but yes, at age 11, start with the vaccine because that will help. I don't know if that answers your question.
Yes. Yes, it does. Thank you. Mhm.
You're welcome.
I have a question.
Yes, go ahead, please.
Okay. So if a woman starts having, or a girl starts having sex before age 18 or before age 21, should she start to get tested at that point with the pap smear?
Well,
Because, I mean, nowadays it's like kids are losing their virginities at younger ages. So should we start monitoring them at that point?
well, that's a decision that has to be taken with the patient, the family, and the doctor, of course. But in my opinion, yes, of course. If a patient starts having sex before 21, 2018, yes, they should start having their annual pap smear since probably a year after they start having sexual relationships. Yeah.
Okay.
I have a question, Dr. Mason. You mentioned about diet, fruits and vegetables. Um, how does that play a part as far as cervical cancer is concerned?
It plays a very important role. As I was saying, not only in cervical cancer, but in many other cancers, but specifically here, um, as I would say the key point is the immune system. The immune system is very, very, very complex. It's a system that it's made of cells that have to communicate one with others using chemical factors. So for them to be able to communicate properly, they have to have certain specific conditions, pH, certain chemicals, certain hormones. And if we don't have the necessary base to build them, then it will make that difficult for the immune system to detect an abnormality. So, for example, we now know that vegetables are an excellent source for vitamin C, for vitamin B, for vitamin K, and certain other elements like magnesium and potassium, which are very related to the immune response. What happens? That cancer and cervical cancer very specifically is developing all the time in healthy women, but the immune system is able to detect that very early, and attacks it and doesn't let him develop. So it dies. But if we don't have the immune system properly tuned with the right food, with the right ingredients for, then it will develop more easily.
Okay, thank you.
Are women that are diagnosed with cervical cancer more likely to develop another form of cancer?
There are certain risk factors that make them that might make them more susceptible to other cancers. It depends on the specific risk factor, but not really. Maybe the relationship between the HPV and other types of cancer. Yes, for example, you can have larynx cancer. So if you're infected, that might be something you might develop. The correlation is very weak. It's not that we have a lot of cases, but yes, in theory, there is a relationship. And also certain cancers of the vagina and the vulva, which is not the same. Remember that the cervix, the vagina, and the vulva are three different parts of the reproductive system, but they can all be affected by the human papillomavirus. And in a certain way, yes, having it in the cervix might tell us that you have it somewhere else and you might develop some other cancers. And I want to add that this is also for men, because HPV is related to penile cancer. So it is very important for them also.
Thank you.
Well, doctor, I have a question for you.
Yes, go ahead.
What's the medical opinion about the early detection and early treatment, such as surgery and complete removal of the uterus for a patient that hasn't been diagnosed yet, but she has a very good chances to develop a uterus cancer?
Sorry, can you repeat that? Is I couldn't listen to the first part, but can you repeat, please?
Yeah, let me lower the volume. Yeah, thank you. What is the medical opinion about a patient, for example, that has a very good chance to develop uterus cancer, and about like removing or having a surgery, major surgery, removing her uterus? Is it good for her to have an early surgery in order to be like a preventive thing?
Okay, I think I understand the question. What you're trying to ask me is that if, what do I think about having a surgery to prevent the developing of cancer in a patient that has high risk of developing? Well, this is something that we actually do in certain types of cancer, being very specific with breast cancer. I mean, since we already developed certain genes that we can detect with breast cancer, then what we call prophylactic, which means preventive, surgery is done in those cases, because the chances of those women to develop cancer are so high that we prefer to remove the tissue before they develop any symptoms. Now, in cervical cancer, that is not, I mean, we haven't identified that genes yet, so we are not offering that possibility right now. It wouldn't be, we don't have enough information as to suggest such treatment. In other cancers of the uterus, like of the endometrium, maybe we could do it, but it's not something we offer. What we do is that if we detect certain abnormality in the uterus, either the cervix or the body or anywhere, and the woman is in a certain age where she's also developing other problems coming from the uterus, like fibroids or abnormal menses or bleeding, then we might suggest, instead of just treating the cancer locally, remove the whole organ, because it will be actually, it will give them a better chance.
Okay, thank you very much.
You're welcome.
Question. You could remove the cervix without having to remove the entire uterus. Is that correct?
Well, actually, the opposite is what is most commonly done. Because hysterectomy, which is the removal of the uterus, it's a very common procedure. Why? Because women start developing, like I was saying, bleeding or fibroids, and the uterus must be removed. But what we do is that we leave sometimes the cervix in place. Now, removing the cervix and keeping the rest wouldn't be very useful. It can be done, but it wouldn't serve any purpose, because the uterus has an opening that goes to the vagina, so the women can uh, uh, have their periods and blood comes out of there. So if we close and we take the cervix out, then probably, something's gonna be wrong. But what we can do is take the cervix, take the rest of the uterus out, and leave the ovaries, so that we're not causing an early menopause. That can be done. Yeah.
Dr. Mesa,
Yes.
hysterectomy, then, would that be a viable preventive method?
Well, I will answer this question. The way I was taught about the uterus, maybe it's not the best way to say it, but I will say it as I was taught. The old teachers, doctors said that the uterus, it's made for two things. The purpose of the uterus is having babies and developing cancer. That's what they teach us. So of course we grow as doctors with the fear that if we leave for the uterus for many years having symptoms, our patients will develop cancer. So in my opinion, I would not recommend all women to remove the uterus, to have a hysterectomy just to prevent cervical cancer. But if you have to have a hysterectomy for other reasons, like fibroids or any other condition, I would ask your doctor to consider doing a total hysterectomy. That means removing the cervix, because it wouldn't be fair for you to have a hysterectomy and 2 years later have cervical cancer and then having to have another surgery for that. So if you're going to have it, and if you are in a certain risk, you have certain risk factors, then you should suggest to your doctor to do the total hysterectomy. That's what I would recommend.
Okay, thank you.
Okay.
Okay, I think that's about it.
Thank you, everybody. I hope you enjoy it.
Hey, thanks. Bye.